Hi, I'm Robin Brumble, a registered nurse and Director of Scientific Affairs and Research at CLL Society. Many other cancer societies fund general research, but CLL Society's program is one of the very few programs that is dedicated solely to directing funding towards only CLL research. So I'm happy to share today that after a rigorous application process, our research review committee, which is comprised of some of the top CLL physicians in the country, has chosen Dr. Christine Ryan as our very first awardee for our inaugural year of the program. So, Dr. Ryan, would you please introduce yourself and tell us a little bit about who you are and where you're from?
Of course. Thank you so much, Robin. I'm so excited and grateful to be speaking with you today. As mentioned, my name is Christine Ryan. I am originally from the San Francisco Bay Area. That's where I was born and raised. I then completed my undergraduate studies at the University of California, Los Angeles. I earned a bachelor's of science in molecular cell and developmental biology. I then attended medical school at Stanford University and then made the big trek out to the East Coast where I moved to Boston for my internal medicine residency training at Brigham and Women's Hospital. And I am currently a senior hematology oncology fellow at Dana-Farber Cancer Institute, and I'm specializing in lymphomas and CLL.
Great. So, Dr. Ryan, tell us how you first became interested in CLL.
Yeah, that's a wonderful question. So one of my very first experiences actually shadowing a physician was with an oncologist who had many CLL patients. And so I really sort of was introduced to the field of medicine and CLL at the same time, and that really sparked my interest in the disease. Over time, I've really come to love and appreciate the longitudinal relationships, these long-term relationships that CLL patients have with their physicians. And that's something that is really special to me and something I really value. And I also think it's just such an exciting time to be conducting research in CLL, given all of the tremendous advancements in recent years.
Yeah, that's very true. Well, how about why don't you tell us a little bit about your CLL training and who some of your mentors have been?
Absolutely. So as I had mentioned, I obtained my medical degree from Stanford University, and one of my primary mentors there was Dr. David Miklos. In many ways, I have him to thank for introducing me to the field of medicine. I had first worked in his lab as an undergraduate student, and then he offered me the opportunity to shadow him in clinic. And it was really that experience and that opportunity that sparked my interest in medicine, and having the opportunity to work with him throughout medical school really sparked my interest in clinical research overall. I then completed my residency at Brigham and Women's Hospital, part of the Harvard Medical School system. And as I mentioned, currently in fellowship at Dana-Farber Cancer Institute. And here, my primary mentor throughout residency and fellowship has been Dr. Matthew Davids. And I really cannot say enough about how incredible Dr. Davids is as a mentor. As you well know, he is, of course, a giant in the field of CLL and a world-renowned researcher and clinician. And it's been just such an amazing and valuable experience to learn CLL management from him and caring for patients with him in clinic each week. But he has also provided just tremendous research opportunities for me and invaluable career guidance. He's incredibly kind and caring and patient, and I'm just very grateful that I have the opportunity to work with him and learn from him.
That's wonderful. Dr. Davis is also on our medical advisory board and has committed a tremendous amount to CLL Society, and we're very grateful for him as well. So, as the first ever awardee of CLL Society's Young Investigator Award, can you tell us a little bit about your research project, what the title of it is, why you chose it?
Yes, so the title of my research project is BH3 profiling to identify novel vulnerabilities in Richter syndrome. And I'll explain a little bit about each of those components. In terms of why this project, I am particularly interested in Richter's syndrome because it is really a significant unmet need for our patients with CLL and SLL. Richter's is a disease transformation, so it develops often develops in patients who have CLL or SLL, and their disease actually transforms or changes to an aggressive lymphoma. And that newly transformed disease, what we call that Richter syndrome, has a very poor prognosis overall, where most patients can survive in some cases less than a year from their diagnosis. And so we are very excited about trying to make advancements, particularly in the treatment of Richter syndrome. We really need new and effective treatments, and that's why I am very excited about this research project. Now, I mentioned in the title something called BH3 profiling, and what this is something we call a functional medicine, precision medicine technique. And to explain a little bit about how that works. So normally cells die through a process called apoptosis, and that process is regulated by different specialized proteins. So some of those proteins promote cell survival, while others of those proteins promote cell death. And it's this balance between the proteins that are promoting survival versus the ones that are promoting death that ultimately decides sort of the cell fate, whether it lives or dies. Now, cancer cells, as we know, are very smart at sort of out-tricking normal processes and our treatments. And unfortunately, many of them have found ways to upregulate or be more dependent on these pro-survival proteins so that they don't die normally. And so this BH3 profiling assay assesses sort of which proteins the cancer cells are most dependent on for their survival. And in being able to identify those proteins, we can then better understand how Richter syndrome is developing and existing, and also what drugs we can then use to better target Richter syndrome.
Excellent. So how might your research help? You could sort of explain this a little bit, but how might it specifically help understand Richter's syndrome?
Yeah, so as I was explaining, through our research, we are hoping to gain a better understanding of which pro-survival proteins the malignant Richter cells are dependent on. And in doing that research, we are also hoping to investigate which drugs might be most effective at treating Richter syndrome. And so better understanding the biology of the disease and how certain treatments affect the disease, I think will really give us important insights into Richter's overall.
Great. So we often hear about targeted therapies for CLL in general. Would it be fair to say that you're looking at the proteins for Richter's syndrome that might be a good target for a future therapy?
Yeah, I think we're definitely looking into targeted therapies for Richter syndrome. These proteins are present in all cells, but really it's the dependency on those proteins that enables the malignant cells to survive. So yes, we are trying to understand which proteins we can target specifically in Richter syndrome to then treat it more effectively.
That's so exciting. So, well, Dr. Ryan, how do you hope your research might more practically help CLL patients in the future? Because I know we talked about the therapies, but I think there's still a lot to be understood about Richter's syndrome or Richter's transformation. It's also sometimes referred to in general for CLL patients. What would you have to say about that?
Yeah, I think, all the research that we do is absolutely inspired by our patients. And so, all of this research is with our patients in mind. And I think we're very excited and hopeful that this project, these studies will really one day lead to more effective treatments for our patients with Richter syndrome. I think that, these studies which are investigating things at the molecular level will hopefully provide key insights that can then provide the foundation for future clinical trials to investigate new and improved therapies.
Absolutely. So important. Well, do you have any other final thoughts before we close up here?
I just want to say how incredibly honored and grateful I am to receive this Young Investigator Award from CLL Society. I was just so excited when I heard the news, and I am incredibly excited about the support for this research project. As I said, I'm just very passionate about this particular area within CLL and SLL, and I think that this award will really provide important support for our efforts to make advancements in the treatment of Richter's. So thank you to you, Robin, and to Dr. Kaufman and all of the CLL Society.
Well, Dr. Ryan, we would also like to thank you and your colleagues for this very important area of research that you're doing. And this is definitely a very important topic for those with CLL and SLL that needs much more exploration. And I know that all of us here at CLL Society are very much looking forward to where this will lead in the future. And I'd just like to thank you so much for your time today.
Of course, it's truly my honor. Thank you.